Hi, I'm Dr. S, and I'm going to show you how I teach my patients to put in their contact lenses. It's a little bit different from the way most people learn, and I think it's a little bit easier. You should only wear contacts under the care and supervision of an optometrist. You should always follow the wear schedule and replacement schedule and all the directions your optometrist gives you. That way you'll be a successful contact lens patient. It's really important that you don't wear your contacts if you think you have an eye infection, if your vision's blurry, your eyes look red, or your eyes feel uncomfortable. Okay, so here we go. Okay, so the first thing we're going to do before we do anything else when we're ready to put in our contacts is wash our hands. This is the most important step. Anytime you touch your eye or your contacts, you have to wash your hands first. That way you can prevent getting infections. It's good to use a soap that doesn't have lotion in it because the lotion can coat your hands and then get onto your contact lenses. Okay. I'm going to show you also how to open the package that the lenses come in. A lot of you are going to wear disposable contacts. They come in a little blister pack, we call it. And the best way to open it is to just peel back the edge and just open it up. And there's a lens in there and some fresh solution. Okay. I also recommend working over a counter with a nice big mirror in a place where you can stand up. It's harder to put in your contacts when you're sitting down, at least using this technique that I'm going to show you. I also lay down a nice dark towel, and the reason for that is if you drop your lens, you can find it really easily next to the dark towel. And believe me, you're going to drop your lens. So, other places to look for your lens if you drop it: on the mirror, on the wall, on your clothes, on your hand, and sometimes you think you've dropped it, but it's really in your eye. So I hope that helps. Okay, so I'm going to show you how to put your contact lenses in. Just take it out of the little package. The first thing you want to do is to try to see if it's inside out. And the way to tell is to put it up on the edge of your finger and look at the edge. If the top edge of the contact lens makes a nice cup shape, then that's right. When it's inside out, the top edge flares out a little bit. Okay, so now we've determined if the lens is inside out. And one thing I do want to tell you is don't worry about the lens being inside out. People get so panicked. I don't know. Is it this way? Is it that way? What should I do? If you put your lens on and it doesn't feel good, it's moving all over the place, it's probably inside out. Take it out, flip it the other way, and try again. If it feels good, that's right. Remember, before you go to put your lenses in, make sure you don't have an eye infection, your eyes aren't red, feeling uncomfortable, and that your vision seems okay. All right, so what we're going to do is instead of putting it on the tip of our finger, which is what a lot of people are taught, we are going to put the contact lens right up on the side of your pointer finger like this. Okay, and near the end of your finger. Then what you do is you lean in towards the mirror. You use your right hand to put in the right lens. You're going to use your opposite hand to pull down your lower lid. Just like this. See how my chin's down? Not like this with my chin up. Chin down, pull down, and then using the right angle, I'm just going to push the lens onto my eyeball. When I feel the lens is on, I pull my finger straight away, gently let go of my lower lid, bring my chin up, the lens goes right up into place. Now, I know a lot of you are taught to hold your upper lid out of the way and then do this. I think that's much harder. When you go to grab your upper lid, your lid's instinct is just to slam shut. And I think it makes it more difficult. So we find it more successful this way. I'm going to show you how to put the other lens in. The other thing that's a little bit different than I'm sure most of you learned is to put the left one in, I'm going to use my left hand. And I know you're all saying, I'm right-handed, I can't use my left hand. Yes, you can. Yes, you can. It works better because you're not coming across your face at a funny angle. You're coming in from the same side. So here we go. Up on the side of my finger, I'm making sure my finger is not too wet. just like this. Looks like it's not inside out. I don't see a rip on my lens. We also don't want to wear a lens that's ripped. If you think it's ripped, throw it out. Okay, so same positioning. Lean in, chin down, pull down my lower lid, push it on. Now, sometimes people start blinking here. You can also, at that point, grab your lid there and pull it up and use your lower lid to push the lens into place. Here we are. Great. Now, say you put your lens in and you're like, it's not really moving around, but it feels like there's something in my eye, or maybe there's something underneath the lens. One thing you can do is just move your lens around and see if it dislodges what's underneath it. So how you would do that is you lean in and tip your chin down again. Pull down your lower lid with the opposite hand. Take the lens, move it to the side, and then put it back in place. I'd say about 50% of the time, it'll feel better after that, and you can just leave the lens in. Now, if you move it around and it still feels bad, take the lens out, rinse it with solution, put it back on and try it again. If you're having trouble making the lens feel comfortable, it might be ripped or defective, so take a good look at it and maybe throw it out. Also, a lot of my patients will say, well, I can't tell if the lens is in or not, and it's a very simple way that you can tell. After you put the lens in, what you're going to do is look at something very far away and cover your other eye. And if you can see clearly in the distance, you know the lens is in. Yeah, must be in and in place. And you can also try to get real close to the mirror, and there'll be like a little ring around the colored part of your eye, a couple millimeters out. That's where the lens rests right on your eye. Okay, so now I'm going to show you how to take your lenses out. And the best thing to do if you know you're going to be taking your lenses out is to put a little drop of contact lens re-wetting drop in your eye a couple minutes before you're going to take them out. That's going to loosen up your lenses a little bit and make it easier to take them out. So, great. Now I'm going to get my contact lens case ready so that I can put my lenses in there to clean them and store them. If you're wearing lenses that are one-day lenses, that means they need to be replaced every day. That means when you take them out, you throw them out. You do not store them in a case. Any other lenses, you take them out and disinfect them overnight in a case. That's a 2-week lens or a 1-month lens. Some people wear 3-month lenses, but it's really important that you listen to your doctor's wear schedule and replacement schedule. Okay. So the contact lens case is marked left and right, but I always recommend opening only one side of the case up at a time. That way you cannot get your lenses mixed up. So I'm going to open up the right side of my case, and I'm going to take my contact lens multi-purpose solution to disinfect them, and I'm going to fill it all the way up. This is another mistake people make. They put a few drops of solution. You can't be stingy. You got to fill it all the way up to the top. Okay, now I'm ready to take out my lenses. Okay. So to take your lenses out, once again, you're going to use your right hand to take out your right lens and your left to take out your left. Same positioning. I'm going to stand up tall, lean in towards the mirror. I'm going to tip my chin down. I'm going to pull down my lower lid with my opposite hand. My right hand, the side of my finger right here, not the tip where the nail can get me, is going to touch right where the colored and the white part meet on my eye. I'm going to touch my eye nice and hard. I'm going to grab that lens and I'm going to pull it down, pull it down, pull it down, keep pulling. It hits that crease right down here and it will roll right out of your eye. Now, it cannot go underneath your eye. That's all sealed up. So don't worry about really pulling the lens down to get it to go into that fold, to wrinkle, and just come right out. I like this much better than pinching it directly off your eye because I think you have more risk of scratching your cornea or hurting yourself doing it the other way. Okay? Now what we're going to do is we're going to put the lens in the palm of our hand to clean it with a couple drops of solution. Just going to do a gentle, gentle rub. And then I'm going to do a little rinse. And then I'm going to drop it right into my solution. Make sure it goes down to the very bottom and that it's not floating on the top. Make sure it's not up here at the edge of the case so when I close my case, I don't rip it. All right, so now I'm going to take my other one out with my other hand. I'm going to fill it all the way up to the top with the solution, so I'm ready. Good. Okay. Ready? Lean in, chin down, pull down, touch right where the white and the colored meet with the side of my finger. Down, down, down. Hello. Got it out. Okay. Little bit of solution, rub, a rinse, and right down into the case. Close it up. Stays in there overnight for at least 6 hours, and then they're disinfected and you can wear them again in the morning. Now, to take them out of the case in the morning, the best way to do it is to take one cover off at a time, and I usually say to just dump the solution into your hand, just like this. And there's the lens. That way we're not fishing around in the case and having a chance of ripping the lens. Okay, so now you know a different way to put in your contacts. If you've been having trouble with the way that you were taught, you can try this way. We find it really successful. A couple more tips that I just wanted to give you. Contact lenses should never go in your mouth and then go in your eye. That's a horrible thing to do, a very bad idea. And never use tap water on your contacts, only solution, okay? Very important. If you do wear makeup, you want to make sure you put your contacts in first and then you put your makeup on after that. Also, you would want to take your lenses out before you take off your makeup at the end of the day. I hope you enjoyed this little lesson and take care.